Welcome to Rajendra Tandon videos. Today, under the homeopathic system of medicine, I am dealing with 5 problems relating to respiratory system. The first one is emphysema. It is chronic obstructive pulmonary disease. It's a progressive loss of lung elasticity, usually caused by smoking. The tiny air sacs in the lungs are inflated and distended. Their walls become thin and rupture. There is difficulty in breathing, in exhalation, wheezing, severe persistent cough. The chest shapes into a barrel. It's a remarkable symptom. Chest shapes into a barrel. I have seen some such barrels. Loss of weight. The skin color turns blue with exertion. Morning cough produces sputum. Production of yellow or green sputum as time passes. As the disease progresses, shortness of breath even while at rest. The symptoms are worse in cold weather or with other respiratory problems like influenza. It would be a wise decision to consult a doctor at the earliest. But the homeopathic medicines as recommended help considerably. When there is stitching pain in the chest, when bronchial tubes lack strength, the breathing is oppressive, asthmatic, resulting in fainting. There is a persistent cough, worse 3 to 4 am. There is pulmonary edema, that is swelling in the lungs. The lungs are choked with mucus, difficult to expectorate. Give ammonium carb 30, AMMONIUM CARB 30. When the symptoms are accompanied by burning in the chest, the face is blue, perspiration is cold, the patient suffocates while breathing, the chest tight as if bound by a hoop, great anxiety, restlessness, better from heat, warm drinks, and head elevated, worse during wet weather, after midnight, from cold drinks, cold food. This patient requires arsenic alb 200. The next medicine is carboveg 200, which is required as a follow-up to arsenic in chronic cases, neglected cases of emphysema. The cough is spasmodic, violent, watery, copious expectoration, cold hands, cold feet, cold breath, the skin is blue. It's a total lack of oxygen because he can't breathe. Where from oxygen will come? In cases of wheezing nausea, give Ipecac 200. And if mucus does not yield, use Entim Tart 1000, a remarkable remedy. When the mucus does not yield, that is, does not come out. The lungs are full of mucus, dry, spasmodic cough in old patients, difficulty in inhaling and exhaling. Next, I take up problems of old persons relating to their lungs. When inability to take out noisy, rattling mucus, the lung function is weak, as advised earlier, antimony tart 1000. In chronic catarrh of the lungs, enfeebled pulmonary circulation, bacillium, BACILLINUM, bacillinum 200 is required. In bronchial affliction along with cardiac dilation, we require Baryta Mur, BARYTA MUR 30. And asthma in aged persons, extreme debility, face blue, imperfect oxygenation, poor digestion, acidity. A sure remedy is carboveg 200. You can go on giving it for a month even. It does not matter. It will help. It's a remarkable medicine. When bronchitis comes in old exhausted persons, thick yellow tenacious expectoration, hydrestis 200, HYDRASTIS 200. But if the mucus doesn't come, go back to Entim-Tart 200 and add hydrestis 200. Next I take up pain in the area of the lungs, sudden pain in the chest on exposure to dry cold air. In pleurisy we require aconite nap 30. Now this pain is different from pain in the heart attack. That comes as a constriction mostly on the right side and travels from the right shoulder to the left side. This pain is in the lungs area and it comes on exposure to dry cold air. Aconite nap 30. Pain caused by injury to chest, bones and cartilages. Arnica 200. For any injury, and here because the pain has come to cartilages on account of injury, we require arnica 200. If there is severe pain in the upper right lung, very specific symptom, give arsenic alb 200. When there is severe pain in larynx, give belladonna 200. Soreness of muscles and bones in influenza require eupatorium perf 200. Here muscles have come in, bones have come in, and the remedy is eupatorium perf 200. Even if you are confused about symptoms, take 2-3 of these medicines but separately during the course of the day. You would get relief. When the left lung is sore, oxalic acid 30. There is a loss of voice with cardiac problems. Last of all, larynx is painful. The patient cannot talk. Sharp stitches and heat in the chest. Mind you, sharp stitches and heat in the chest. We require phosphorus 200. Paralysis of the lungs requires Entim-Tart 1000. Inability to take out coarse, rattling, noisy mucus. In the hospital they put a pump, suction pump, to take out the mucus. I prescribe Entim-Tart 1000. It works better than any pump. The last item in today's video is tickling. Tickling of the throat, larynx, palate. It's a very common phenomenon. Give Allium cepa 200 when the larynx is hoarse, the throat is hoarse. आवाज बैठ गई है. Violent rapid inflammation, hacking cough. But when the tickling is extremely bothersome, unpleasant in palate, nose, eyes, acute onset of cold, a very effective remedy is Arundo, ARUNDO 200. I would add one more remedy here for tickling. Aconite 30 followed by Arundo 200. Remarkable effect. Please listen to this video if you have these problems again and again, and you would find that you have easily available remedies. Thank you. We meet again.